Insomnia. Causes and solutions for better sleep. Welcome back to HGH Health Hub. Recover and thrive. Today, we're talking about insomnia, a common sleep disorder that affects millions of people worldwide. We'll explore its causes, risks, and practical solutions to help you achieve better sleep. Don't forget to like, subscribe, and hit the notification bell for more health and wellness tips. Let's get started. What is insomnia? Insomnia is a condition where you have difficulty falling asleep, staying asleep, or both, even when you have the opportunity to sleep. It can leave you feeling tired, irritable, and unable to focus during the day. Insomnia can be acute, short-term, or chronic, long-term, depending on its duration. Host. Quick fact. Experts recommend adults get 7-9 hours of sleep per night for optimal health. Common causes of insomnia. Insomnia can have many causes, including stress, work pressures, personal issues, or major life changes can keep your mind active at night. Lifestyle habits. Irregular sleep schedules, excessive caffeine, or screen time before bed can disrupt sleep. Medical conditions. Chronic pain, asthma, or acid reflux can make it difficult to sleep. Mental health disorders. Anxiety and depression are often linked to insomnia. Medications. Some drugs, such as those for asthma or high blood pressure, may interfere with sleep. Risks of insomnia. Chronic insomnia can have serious effects on your health, including increased risk of heart disease and diabetes, weakened immune system, mental health challenges, such as anxiety or depression, reduced focus, memory, and productivity. Important note: long-term sleep deprivation can impact your overall quality of life, so it's crucial to address insomnia early. Solutions for better sleep. Here are some effective strategies to improve your sleep. Maintain a sleep schedule. Go to bed and wake up at the same time every day, even on weekends. Create a relaxing bedtime routine. Activities like reading, meditation, or a warm bath can signal your body that it's time to wind down. Optimize your sleep environment. Keep your bedroom dark, quiet, and cool, and invest in a comfortable mattress and pillows. Limit stimulants. Avoid caffeine, nicotine, and large meals at least a few hours before bedtime. Reduce screen time. The blue light from devices can interfere with your body's natural sleep cycle. Try to power down electronics an hour before bed. Exercise regularly. Physical activity during the day can promote better sleep, but avoid vigorous exercise close to bedtime. Seek professional help. If insomnia persists, consult a doctor or sleep specialist who can recommend therapies such as cognitive behavioral therapy for insomnia, CBTI, or medications. When to seek help. While occasional sleeplessness is normal, it's time to see a doctor if insomnia lasts longer than 3 weeks. It significantly impacts your daily life. You experience symptoms like severe fatigue or mood changes. Insomnia can feel overwhelming, but with the right approach, you can regain control of your sleep and your health. If this video was helpful, give it a thumbs up and share it with someone who might benefit. Don't forget to subscribe to HGH Health Hub. Recover and thrive for more health insights. Thanks for watching, and sweet dreams.